I'm Rich Taffel here at the White House with the Weekly Strategy Memo. And I'm here with a lot of other people who are trying to figure out, how do you impact the president? And that's the theme for this week's memo. How do you impact this president here at the White House? How do you impact the president of your organization? And the question this week is about healthcare and how we impact that. And if you follow it, it's going to be a strategic template for you to use to impact your president or your own company.
It seems like the president's healthcare plan is in serious danger of failing. I'd love to get your perspective on how to reform healthcare and what you'd recommend to the administration. Signed, Yes We Can. Only a fool would attempt to answer this question in under 4 minutes, so I'll give it a shot. Let's use the healthcare debate as a case study for how to write a strategic analysis for your organization, for your own business, or if you want to affect public policy. So 3 acronyms I'd like to teach you today are KISS, KIT, and SWAT. I know it sounds a little bit like a Craigslist ad. Bear with me. KISS means keep it simple. KIT, keep it true. The best strategies are true.
Want the truth? You can't handle the truth.
And SWOT, which stands for strengths, weaknesses, opportunities, and threats. One thing to remember, particularly in a public policy debate, is you've got to pay as much time to the politics as the policy. You've got to pay as much attention to the policy as the politics. And that's often true within organizations as well. Okay, let's do our SWOT on healthcare. And the first thing we're going to look at is strengths. The strengths, politically, this president's party controls the House and the Senate with a veto-proof Senate, and he's a great communicator. That's a good start. Now, the strengths in the policy side are that most people feel some need for change in the healthcare system, and the other really good thing in the policy arena is that most people are actually covered through healthcare. In really rough terms, about 65% of the people are covered through their employer or through themselves, and that leaves about 25% who are covered through government payments of some type, Medicare, Medicaid, or the military, and that leaves the uninsured at about 10%. So it's a relatively small group that's not insured. Okay, so now let's look at weaknesses. The weaknesses politically is that the opposing party, the Republicans, succeed at your failure. The other big weakness politically is that the Democratic Party itself is not speaking with one solid voice. The weaknesses from a policy perspective is the problem has not been very clearly defined. The solutions sound very confusing. People have a high distrust of government, and there's a real deficit fatigue out there. Okay, now we've got our strengths and weaknesses. Let's look at the opportunities here. The opportunities politically is there's a real chance of passing something that would be incredible for your presidency. There's also a chance to be bipartisan. The opportunities from a policy perspective, they're pretty obvious, to make a lasting change for people who are really in need. Okay, we looked at strengths and weaknesses, opportunities. Now let's look at the threats. The primary political threat for the president is that if he fails to pass health care reform, it could really look bad for his presidency. So that's just a political reality for him. Also, the big threat here is that you're creating such divisions that you might actually energize your opposition. The threats from a policy perspective are that you could really pass something worse than the status quo, or you could actually look like you're changing things and not change anything at all. Okay, to seize the opportunities and mitigate the threats, the key for us now is going to be to simplify this issue. The issue is define the government's role as regulator, not health provider. Focus primarily on the 10% that are not covered, and state this as an issue of health insurance reform, which the public is hungry for. Your analysis is done, and you're ready to make recommendations. Pay less attention to the recommendations that I'm offering. They're just really a case study of how you might organize your thoughts. So in this case, what I would suggest is that the government mandate healthcare coverage. The insurance industry has to cover the 10% currently not covered, and they need to eliminate the barrier of pre-existing conditions. You can threaten the public option if they say this can't be done. Reduce the ability for people to sue in the medical arena. And finally, for people particularly on Medicaid, you want to really incentivize prevention and wellness.
Okay, Okay, so today you heard about KIT, Keep It True, KISS, Keep It Simple, and you heard about SWOT, Strengths, Weaknesses, Opportunities, and Threats. These are a great way to organize your thoughts so that you can write a strategy memo and really have an impact on public policy, the policy of your organization, or your own business. Thanks for watching.
They tried to make me go to rehab. I said no.